Hi to all of you. Uh, Today I'll be discussing about colorectal cancer. Uh, Colorectal cancer. We'll talk about the facts and risk factors of the disease, symptoms, how to reduce your risk, various screening options, and this incidence and prevalence of this particular problem in the United States. This has been a huge problem after a certain age, and that is why it is important that we discuss about this topic. Uh, Colon cancer is called as colon cancer, and the cancer of rectum is called the rectal cancer. Since they have the same features, same symptoms, and same risk factors, they are grouped together as colorectal cancer. Mm. It is colorectal cancer is the second most cause of cancer death in the United States. Most colorectal cancers, they will start as a small growth from the inner lining of the colon. This growth is called polyp. They'll keep increasing and become multiple in number. Some of them, however, will turn into cancer. Not all polyps will become cancerous, but it's a long process. It's not an immediate phenomena. They are benign tumors to begin with, but over the period, maybe 10 to 12 years, they can become cancerous. It is since they are symptom less in the beginning, and the symptoms will actually start once the number increases or they become cancerous. So early screening and early detection will go a long way in preventing the mortality due to colorectal cancer. Later the diagnosis, the poor is the prognosis. There are various risk factors. Your risk factor of getting colorectal cancer increases as you get older. About 90% of cases of colorectal cancer are above the age of 45 years. This also means that 10% of cases they are below the age of 45 years, and actually the incidence of colorectal cancer is increasing in younger age. Gradually, the youngest patient detected with colorectal cancer was only 18 years old. There are several risk factors which are preventable, and there are some of them which are non-preventable. Non-preventable means that you have, suppose if you have a history of inflammatory bowel disease, or if you have uh, a strong family history of colorectal cancer, the inflammatory bowel disease like Crohn's disease or ulcerative colitis, they make you more prone to cancer. This is not in your control. A personal family history or certain racial background. Uh, for example, the African Americans, they have a greater incidence of colorectal cancer. Other groups are French Canadians and Ashkenazi Jews. Uh, so if you belong to this particular group, then your risk is definitely more. Then there are certain genetic syndromes. There are about 5% of cases of colorectal cancer, which where in those patients we find some mutated genes. And this mutated gene is part of a syndrome. The most common syndrome which we know of is Lynch syndrome. This Lynch syndrome is also known as hereditary non-polyposis colorectal cancer. This is a autosomal dominant condition. That means about half the offsprings are prone to getting this cancer. So if you have a strong family history of colorectal cancer in the family, that will be a good idea to get yourself tested for this particular gene. Uh, there are other syndromes also which have mutated genes in them, like familial adenomatous polyposis, juvenile polyposis, uh, or Peutz-Jeghers syndrome. However, a detailed discussion of these syndromes is beyond the scope of this presentation today. Uh, as I said, about 5% of cases are of or colorectal cancer are of due to mutated genes, out of which Reich syndrome is Lynch syndrome is about in 3% of cases. There are certain factors which are definitely in our control, which we can. These are lifestyle factors. If we take care of our lifestyle factors, we can prevent development and incidence of colorectal cancer. For example, obesity. Uh, Obesity increases your risk of getting cancer. So if somebody is overweight, and that means there is a lot of abdominal fat, and this abdominal fat is an indication that you have increased fat around the viscera also, and this visceral fat exposes you to getting cancer. So reduce your weight, increase your physical activity, control your diet. It has been seen that a diet which is low in fruits, vegetables, or high in uh, red meat like beef, pork, or lamb, or pasteurized meat, or high sugary beverages. So all these conditions will increase your weight, and this diet exposes and predisposes you to getting more of cancer. So reduce intake of red meat, take more of green vegetables, take high fibrous diet, take fruits and vegetables. These fresh fruits and vegetables, they have flavonoids also, which have anti-inflammatory property, which is good for reducing other illnesses, including colorectal cancer. Smoking is another big risk factor. Smoking of any time, whether you smoke cigar or you smoke a cigarette or you smoke a low nicotine cigarette, they all have the same kind of risk. So quit smoking and reduce intake of alcohol. Alcohol in male, one can say about 2 drinks a day, and in women about 1 drink a day. That keep that at the upper limit. So these factors, we have seen that there are certain which we cannot control, like your inflammatory bowel disease, your personal history, if you are part of a genetic syndrome. But there are others which you can control, like obesity, like a good diet, like reducing your tobacco and reducing your alcohol intake. Most of these colorectal cancers in the beginning are symptomless. Symptoms only develop once the disease has increased beyond a certain stage. And if it is diagnosed late, then of course the prognosis is poor. However, there are about 5 symptoms which I would like you to keep in mind. Number one, if there is change in your bowel habits. Change in your bowel habits means if you are having constipation, loose stools, or narrow stools, these symptoms can occur from time to time from anybody, but if they persist for long, then that will be a good idea that you should report this to your doctor. Second important symptom is blood in your stool. Blood may be very small, which is not visible to the naked eye, or it may be in large quantity when it is fresh. If you have seen traces of blood in your toilet paper, uh, uh, especially if you have noticed it that more than once, then it is the time that you should report to your doctor. However, if you are suffering from hemorrhoids or fissures, just let the doctor know that also, because that can also cause blood in the stool. So not all blood in the stool will probably mean it is cancer. So if you have blood, you report to your doctor and he'll investigate and see what is the cause for that. Uh, Number three, third main symptom is your abdominal pain. Uh, Initially, there may not be any symptom, but there may be cramps or low back pain, or when the tumors they become multiple and large in size, there may be a dull, sustained abdominal pain. Fourth important cause is your unexplained weight loss. Uh, Weight loss can occur in any cancer, or for that matter, any disease, a long-standing disease. But in case you are losing weight, and if you have lost more than 10 pounds without making any efforts for it, like without dieting or without extra exercising, then that is something which you should not ignore and let your doctor know about it. Lastly, if you have incomplete feeling of emptiness after passing stool, you have been to the toilet, but you still feel that you have not evacuated completely. So that is a sign of something wrong and it should be investigated. To all this, I'll add one thing, which is anemia. With the chronic blood loss, the person tends to become anemic. And if you find that your hemoglobin level is falling repeatedly, then this is the time that you should be investigated further. So if we take care of these three symptoms and report on time, where the cause will be found, and various screening methods will be applied, which we'll discuss later, for early diagnosis and timely action. Uh, Now, this is, you can see the statistic that colorectal is the third most common cancer diagnosis in men and women in the United States. Uh, the American Cancer Society, for the year 2023, they have predicted that there would be at least 106,000 new cases of colon cancer and 44,000 of new cases of rectal cancer. Approximately 4.4% of men and 4.1% of women will be diagnosed of colorectal cancer in their lifetime. Uh, American Cancer Society has further estimated that for 2023, approximately 52,580 deaths, and your lifetime risk is about 1 is to 24. So you can see that it is not a minor issue. It's a big medical issue, and you need to take timely action regarding early diagnosis and whatever your doctor advises. You should begin screening for colorectal cancer at the age of 45 and continue at regular intervals depending on the result of your screening. If there is a strong family history in your family, or if you have risk factors like inflammatory bowel disease, or if you belong to a certain racial background, then your screening can start before 45 also. There are various tests um, uh, for screening. There are stool-based tests, which are done in this stool, which you can do at home. These tests are less invasive and easier to have done, but they need to be done more often. These tests are typically done at home, so many people find it easier than doing other tests like flexible sigmoidoscopy or colonoscopy. But these tests need to be done more frequently. So first of it is your occult blood in stool. Occult blood means the test of hidden blood in stool. GOAC-based test has been recommended by the American Cancer Society. This you will collect a small sample of stool, put in a container, and send it to the lab. If it shows traces of blood, then you need to be investigated further. If it does not show any blood, then that means you need not do anything at the moment, but this should be repeated preferably every year and more frequently if required. Second test, recommended test is called the antibody test in stool. This test uses antibodies to detect traces of blood in stool. This is a test approved by the FDA, and this can be done in patients who are symptomatic, like who have pain in abdomen, like who have changing bowel habits, or those who have loss of weight and they're becoming anemic. For this, you'll get a kit from the doctor. It has a tube and a stick inside. You'll collect a small stool sample, take out the stick, dip that stick in the stool, put it back in the tube and send it for testing. You'll get the result after a week or so. This test, if positive, uh, uh, will need to be investigated further. But if it is negative, then this should be repeated every year. And this is also called as the fecal immunological test, immunochemical test, and this is approved by the FDA. And then we have a DNA test in school. This test detects DNA changes in the cells which are shredded in the stool. A colon which has polyps or a cancer, they keep shedding cells in the stool, and this DNA test detects the changes in those shredded cells and tests traces of blood. And this will be this you can do it asymptomatic people, and it should be repeated every one year or so. And in case the blood is positive, a detailed test will be required. The other tests are the visual test where you actually see the lesion and take appropriate action. One is the flexible sigmoidoscopy. This is a small tube with a tiny camera and a light source attached in at the tip. This can be introduced through the rectum. This is small, so it reaches only up to the level of sigmoid colon. That is why it is called as sigmoidoscopy. At best, it can detect about 70% of cancers because it doesn't go up, and it will miss all the lesions which are higher up in the colon. This test will require some kind of preparation. Uh, you need to be on liquid diet at least for 24 hours. The doctor will advise a laxative before the at the night before the test, and you need to take an enema before you go for the test. Uh, no sedation is normally required unless somebody can take that kind of minor pain. But if you are very apprehensive, they can give you a small sedation. The tube will be introduced through the rectum. They push little amount of gas to dilate the colon so that the lesions can be better visualized. It can also take a biopsy. This should be repeated between 5 to 10 years. It is recommended that if we do a flexible sigmoidoscopy plus the FIT or that antibody test, a combination of these two antibody tests can be done after every year, and the sigmoidoscopy can be repeated every 5 years uh, to detect early cancer. This can also take biopsy, which can be examined and analyzed. Uh, Next is colonoscopy. Colonoscopy is the gold standard test for detecting colorectal cancers. This can also visualize polyps or the cancerous lesions, and they can, if need be, they can be removed through colonoscopy also. This is a long tube. It also has a tiny light source in front with a camera. It is introduced through rectum, and it can screen the entire colon. You'll need preparation for that. Before 24 hours, one has to be in liquid diet, followed by a laxative at night and an enema next morning. The doctor, when they introduce the tube, they'll also put little amount of gas to dilate the colon to better visualize. This test can be repeated every 10 years if you are a low risk patient, or if during the examination they found no polyps. But if there is high risk or if they find polyp, these tests may be repeated earlier than 10 years. So that is the decision which your doctor is going to make. Uh, Another test is a virtual colonoscopy. or a CT cholangiography. This test makes use of specialized X-rays to detect the lesion. Uh, these images will be examined by an expert radiologist who can then decide whether you have uh, polyps which are risky, which are large size, or any cancerous lesion. This will also need some preparation, bowel preparation. Uh, it can be done uh, uh, a day before. You will be empty stomach uh, on liquid diet. Same at night, you'll need to take an laxative. Next morning, they'll give you an enema. Uh, Before the test, you'll be asked to take um, a contrast media, and then you'll be put on a CT scan machine. This machine will take multiple X-rays, which are recorded in a computer, which can be examined by expert radiologist. This can screen polyps. It can look for tumors. It can look for ulcers. It can also look for other inflammatory diseases, and this can scan those areas also where it is difficult for the conventional colonoscopy to reach. This can be done in patients who are on blood thinners, and so that there is a risk of a invasive colonoscopy, or in those people where, because of certain medical conditions, they are not fit cases for uh, a regular conventional colonoscopy. The patient, there's another test in which a patient is made to swallow a tiny camera in a vitamin-sized capsule. You swallow this capsule along with water. This will also need a bowel preparation, 24 hours of no liquid, and at least 12 hours of nil orally. Next morning, swallow that. The doctor will ask you to swallow that capsule, and there will be a recorder which is tied around your abdomen. So as this capsule travels the entire gut, it will take thousands of images, which will be recorded in the recorder which is around your waist. The entire duration of this course is about 8 hours. Or if you have expelled the capsule in your bowel before 8 hours, whichever comes first, after then you can go back to the doctor. He'll take out your recorder, and these images will be transmitted to a computer, and they'll be analyzed for the presence of tumor or any cancerous lesion. This is a non-invasive test, and this depends on places where it is available. So for the screening, now we have stool-based test, which is an occult blood in stool, which do an antibody test, which makes use of antibodies to test traces of blood, a DNA test, which makes use of the DNA changes in the shredded cells. These can be done at home, but antibody test requires a small stool sample, but a DNA test will require the whole stool sample and a preservative to mix, and then these can be sent to the lab, and you get the test. However, the colonoscopy is the gold standard test to detect polyps, and they can actually be removed also. The normal procedure will take about 15 to 30 minutes, depending on how many polyps have to be attended. Now, which screening test is right for me? This is a question which will come in everybody's mind, but there's actually no single best test. Each test has its advantages and disadvantages. Your doctor will discuss the risk and then decide what test is good for you. If you are a low risk case with no family history, no and diseases like inflammatory bowel disease, you may go for basic stool-based tests, but they have to be done more frequently. They can be done at home, but and if at all, if any of these tests they show traces of blood, you'll have to go for extensive uh, examination, which will include a colonoscopy. Um, It'll also depend whether you are very apprehensive, you do not want to go for Pender, you may go for less invasive procedures. You can try for CT colonography, where you only have to take a contrast media, and it is the images, the pictures will ultimately be recorded and analyzed by a radiologist. The likelihood, if of it'll also depend on the likelihood that uh, um, of your getting cancer and access and your insurance facilities, because all these tests may not be available everywhere. So for screening, you have to see what are your preferences and what is your medical condition and what your doctor advises and how much risk you have. Uh, and as per that risk, ultimately it can be decided what screening test is best for you. So in all, we have seen that colorectal cancer uh, is not a small problem, it's a huge problem. And we have seen that there are certain factors which are not within our control, and there are certain factors which we can control, like we can control our weight, we can control our diet, we can improve our activity, we can reduce taking alcohol, we can reduce smoking, maintain a healthy lifestyle, and these lifestyle modifications can reduce your risk of getting colorectal cancer. Screening can find precancerous polyps so that they can be removed before they turn into cancer. Screening should be done screening should be done, as said, that it can be done at 45 years age and above, up till the age of 75 years, depending on your risk and what your doctor says. Being overweight or obese increases the risk of colorectal cancer in both men and women, but the link seems to be more stronger in men. Staying a healthy weight may help you reduce your risk. Being more active lowers the risk of colorectal cancer. Regularly moderate vigorous activity can lower the risk of cancer. Uh, and increasing the amount of intensive and increase your physical activity may reduce in the long term. Control of diet, mainly of red meat, like beef, like lamb, like pork, or processed meat, etc., will be increase your risk. So if you reduce that in the diet, that will be definitely helpful in reducing risk of colorectal cancer. So with this we can see that basically if we can slightly modify our factors, and if we can uh, recognize early, uh, take care of symptoms early, if we report early and go for screening on time, we can definitely control this. The bad prognosis, poor prognosis due to colorectal cancers. So I think with this, that will make you more aware of a problem. This presentation will make you more aware of a problem, which is definitely preventable, or at least you can reduce your risk, and early detection can definitely reduce your chances of getting or colorectal cancer, or in reducing mortality due to colorectal cancer. Thank you so much for your participation. And uh, uh, I think with this we've become more aware of the problem, and we'll try to modify your lifestyle accordingly. Thank you so much.